All right, I'm going to get started and we will. Yes, let's get started. Okay, so. All right. Thank you all for your patience as we've been making sure people can attend and are joining us. So yeah, you all know that today we're talking about the federal budget reconciliation bill that just passed and was signed into law last Friday. The agenda, we're going to go through an overview of the bill and talk specifically about how it impacts the New York State budget and the New York State economy and healthcare system. We'll talk about major changes to Medicaid and healthcare spending, some major changes to SNAP or food stamps. And then we'll also have a quick discussion of policy recommendations for New York State lawmakers. But I want to just make sure you all know that next Thursday at noon, we'll have a follow-up briefing that goes more into depth on policy recommendations for lawmakers. And then we're going to try to leave a significant amount of time for questions and answers at the end. And so, Andrew, I am tossing this to you.
Thank you, Emily. So first off, we're going to just provide a really high-level overview of what this bill, the One Big Beautiful Budget Act, or OBBA, does. So it delivers $4.5 trillion of tax cuts. This is over a 10-year forecast window. So this is the collective tax cuts from 2025 to 2034. And the tax cuts consist primarily of income tax cuts. So income tax rate reductions, increases to the standard deduction, and some of the campaign promises that Trump ran on, including no tax on tips or overtime. It also includes increasing the child tax credit, the maximum benefit from $2,000 to $2,200 per child. Importantly, though, I want to note that it limits the child tax credit to taxpayers where at least one parent has a valid Social Security number, so that sort of removes benefits from mixed status families. While these income tax cuts really might seem and are meant to seem like they would benefit the middle class, the reality is that about 70% of the benefits will accrue to the richest 1/5 of households, and nearly half, or 45% of the benefits, accrue to the richest 5% of households. The bill also includes about $300 billion of spending increases. Notably, $30 billion of that is to ICE. And then the OBBA partly offsets these costs with $1.5 trillion of spending cuts. And we're going to focus on the spending cuts today. But you can think of this at a high level as if the bill is offsetting about 1/3 of the tax cut with spending cuts, and the remaining 2/3, or $3.3 trillion, is not offset. And so it's going to be added to the national debt. Now, where are the spending cuts concentrated? Primarily 4 areas. Can we go to the next slide? So the spending cuts are primarily concentrated in 4 areas, of which Medicaid gets by far the largest hit. So the cumulative cuts to Medicaid will exceed $1 trillion. But there are really 3 other areas that receive that account for the majority of the cuts. This presentation is going to focus in some depth on Medicaid and SNAP, because those are the cuts that have direct fiscal costs to New York State. But I do want to spend a moment to note 2 other areas that receive pretty substantial cuts, which are the IRA. And the cuts there consist primarily of rescissions to tax credits for purchasing electric vehicles, for making home energy or efficiency upgrades, and investment tax credits for renewable energy, especially wind and solar. And so this will really impede the state's ability to meet its CLCPA climate goals, which really depend on increasing the energy efficiency of buildings, and building lots of renewables, especially wind and solar. So the costs will be felt in meeting CLCPA, even though there isn't an immediate on budget impact for New York here. And then the other area I would note are student loans. And the cuts to student loans consist mostly of changes to the repayment plan. So it replaces a lot of the more generous Biden era repayment plans with more stringent ones that will increase student loan holders' monthly payments, and it narrows or forecloses pathways for debt forgiveness. So again, it doesn't have a direct fiscal impact, but it's going to raise repayments for people who hold student loans, reducing their disposable income, and therefore possibly, being a headwind for the economy going forward. There's one other broad part of the bill I want to talk about before we get to the New York State budget, and that's the state and local tax deduction, or SALTs. So prior to 2017, taxpayers could deduct all of the state and local taxes that they paid from their federal taxes, and you get a federal tax benefit from this. Because most of the people who itemize their taxes, which you need to do to take the SALT deduction, and pay a lot of SALT taxes are high income earners, the benefit of being able to deduct SALT really accrues mostly to the top incomes. The 2017 Trump tax cut capped SALT deductions at $10,000. And this really got rid of almost all of the benefit of the SALT deduction, especially for high income earners who pay far more than $10,000 in state and local taxes each year. And so raising the SALT cap was one of the key priorities from Republican lawmakers in blue states that have largely higher taxes. And this really was one of the central points of contention among congressional Republicans, with congressional Republicans from New York and California really staking everything on agreeing to the rest of the bill if we could raise the SALT cap. So the final bill does raise the SALT cap to $40,000. So you can deduct instead of $10,000, you can deduct up to $40,000 of state and local taxes, but only for taxpayers who make less than $500,000. So we ran the math on who benefits from this, and we show this in this chart here. The way to read this chart is that everything above that black line means that there's a positive SALT benefit, and if you're below that black line, it means you really don't get any benefit from this higher SALT cap. And what we found is that you really can only get a benefit from this higher SALT cap if you earn between $300,000 and $500,000, and the benefit is at most about $3,000. So it's really a pretty marginal benefit for an income group that represents about 3% of all taxpayers in the state. And we just want to underscore that the deal really went through because congressional Republicans from New York traded, the pretty devastating cuts we're going to talk about for this fairly marginal tax benefit for a fairly small group of people. And so now we can look at what this actually means for New York State. We go to the next slide. So in total, we expect this to cost New York State about $10 billion a year. Of this, about $8 billion will be cost to Medicaid, and $1.4 billion of this will be costs to SNAP. Now, the Medicaid cuts will start as early as January 2026. That's the last quarter of the current fiscal year. So those Medicaid cuts are a problem for the current year's budget, and lawmakers are going to have to address this in the current year. The SNAP cuts will begin to take effect in October 2026. So this is a problem that's going to become a problem for next year's budget. And then beyond these fiscal costs that are going to hit the state's budget directly, there's another $13 billion of cost to the healthcare system. So while this is not an immediate fiscal cost, it will possibly raise unemployment, cost jobs in hospitals, and that could eventually, that will be a headwind for the state economy and will likely show up as reduced tax revenue. And with that, I'm going to pass it to Michael to talk about Medicaid.
Welcome. Thanks, Andrew. Um, my name is Michael Kanuka, and I'm the Health Policy Director at the Fiscal Policy Institute. And just because we rushed into the Fiscal Policy Institute is a progressive New York State-based think tank. We evaluate policy from the perspective of ensuring that working class people can make it in New York, and we focus on specifically state fiscal issues. And so today most of the rest of the presentation is going to focus on that like state level, state budget, and also state health system impact. We're gonna run through a lot of complicated material pretty quickly here, because we do want to leave about 15 minutes for questions at the end. And so if you have a question, feel free to put it in the chat, but we'll just circle back to it at the end. So I'm going to talk about the single biggest fiscal impact for this bill, which is on New York State's healthcare system. And just starting with the big picture. Next slide. Big picture, this is a huge, huge cut to the New York State healthcare system, to every aspect of it, whether it's hospitals, whether it's the individual market, Medicaid, the essential plan. If you tally up all the costs annually to the state budget when bill is fully implemented, we're looking at $8.4 billion of state fiscal impact, and then a further sort of non-state budget cost of 12.7 billion. That's the amount of federal money that has been flowing into New York State's healthcare system and unfortunately no longer will be. The impact on insurance is also really, really dramatic. The state government has put out estimates that about 1.5 million people will lose insurance as this bill takes effect, which would bring us as a state back up to and even a little bit above pre-ACA levels of uninsurance. We'd be at 11, 12%. There's potential for really, really large impact on the hospital system with dozens of hospital closures. And then that 200,000, I'm sorry, that should be hospital and sort of other jobs lost due to healthcare spending cuts. And I want to say, because there's been some messaging from congressional Republicans that these cuts are targeted at immigrants or at waste, fraud, and abuse. Cuts of this scale are going to impact every aspect of the healthcare system and every aspect of Medicaid in particular, including long-term care services for people with disabilities. Even if they're not directly targeted by the bill creates a fiscal crisis for New York. And so the state is going to face really tough decisions. The other thing I want to say right up front is that this is not a thing where, you know, the cuts are backloaded into 4 or 5 years from now and people won't start seeing the effects immediately. The biggest effects for New York start right away, January 1st, 2026. That's within this state fiscal year. And then the last thing I want to say, and we'll come back to this at the end, is that none of these losses, especially the coverage losses, hospital closures, they're not inevitable. State policymakers in New York are going to have to make choices about how to deal with these cuts. And we have a very strong economy. We have deep reserves as a state. We are in a position to really, really mitigate the impact of these cuts. But what I'm going to be describing is what will happen if the changes laid out go forward. So next slide. Starting with the biggest single impact on New York State is to the New York Essential Plan. The Essential Plan is like, it's a little bit wonky. Sometimes I hear people haven't heard of it, but it's a really important part of the New York State healthcare system. It provides coverage to 1.6 million low-income people who aren't eligible for Medicaid, and that the groups there are US citizens and immigrants who are above the Medicaid eligibility level, but below 250% of the federal poverty line. as well as lawfully present immigrants who are so low income, but that by their income they'd be eligible for Medicaid. But because of federal rules, they're not allowed to get federal Medicaid. And so they're on the essential plan. It's really important. And most of those immigrants are green card holders, all are lawfully present. And this bill will disqualify the vast majority of the immigrants on the essential plan for essential plan coverage, which means the federal funding associated with them will just go away. And so 750,000 people will lose essential plan coverage. Federal funding will go down by more than half, $7.5 billion. And there's a further impact for the state because New York State has a constitutional obligation, according to New York State constitutional litigation from decades ago, that the folks who are income eligible for Medicaid will get Medicaid. And so they'll be shifted onto state-funded Medicaid. The federal government will not contribute, and the state will be paying for those 500,000 people, which is great, but is an additional cost to the state of $2.7 billion a year, again, beginning in 2026. And then those who are not income eligible for Medicaid, unfortunately, will likely just become uninsured starting in January of 2027. So it's a huge hit. It's a loss of 7.5 billion and then an additional cost of 2.7 billion on the state budget. Next slide. A second impact that is both huge and coming at us really fast is the MCO tax that the legislature enacted last year and that we're depending on to fund our Medicaid program is going to be eliminated very quickly, starting again in January 2026. That's an annual loss of 1.6 billion to the state. And that money is right now being used to provide provider rate increases to hospitals and doctors and FQHCs. It's being used to support safety net hospitals and to support general Medicaid spending. And that funding will just go away starting, in less than 6 months. Next slide. Probably the biggest sort of structural change to Medicaid in this bill is that there's this really, really draconian increase in eligibility checks for Medicaid, where eligibility checks will happen every 6 months. They'll be more paperwork intensive, more bureaucratic than they used to be. And people in the ACA expansion population, adults who got Medicaid through the ACA, will be required to prove that they're working or lose their Medicaid. This is a terrible, terrible policy. Most adults on Medicaid either already are working or, they're the primary caretaker for young children or in some other way, they're already meeting the requirements. But because of the red tape associated with this, many, many people will lose coverage. We know this because in other states, that's what happened. It'll happen here. Erecting a giant bureaucracy to take away people's Medicaid benefits also is not cheap. The state will need to build new IT systems. It will need to hire people to run the checks. And New York State has estimated that just the implementation of this system will cost $500 million. And this is probably these changes to Medicaid eligibility, especially the work requirements, are by far the largest driver of coverage losses in the bill. The state has estimated 1.2 million people could lose coverage through these requirements, again, even though most already meet the work requirements. And that coverage loss is going to be really, really challenging for the whole state healthcare system, not only for the people who lose coverage, but for providers who provide care for them and everyone who visits a hospital that is partly funded by Medicaid, which is everyone. So those changes are currently scheduled for January 2026, but anyone who knows state government knows it would defy the laws of physics for a state to set up a system like this that quickly. The bill gives the HHS secretary the authority to sort of grant states extensions. So that's something we'll watch play out. Next slide. I can't cover every bad thing that this bill does. And so I'm just gonna, this is sort of a grab bag of the other things with major state fiscal impacts. There are further changes to provider taxes that will impact hospital funding in New York. There's a restriction on one of the main mechanisms that New York uses to fund safety net hospitals, which is state-directed payments, or it's sometimes called DPT in New York, with sort of an unclear but potentially large impact on both overall funding and flexibility. The Senate bill also fails to extend the disproportionate share hospital cap. So this is a pool of money that has been going to New York State safety nets for decades that has been scheduled to be cut down for about 15 years, but every year Congress extends the cap. This year, so far, they haven't, which is really scary. That could be a very quick $1.8 billion hit to safety net hospitals. The one good change that the Senate made is that in the House bill, there was a major penalty for states that cover undocumented immigrants with state funds. That would have cost New York $1 billion a year. Luckily for us, the Senate parliamentary rules got rid of that cut. So that was the one thing that got better in the Senate. But for the most part, it's worse. It's, sort of a worst case scenario. Next slide. One thing I want to emphasize here is that when you cut healthcare funding, right, like, we spend a lot as a state on Medicaid, but that Medicaid beneficiaries are not the ones who get the money. It's the providers who provide healthcare for them that actually receive the money for providing the care. And in particular, hospitals get the largest chunk of the healthcare spending. The hospital system is really bifurcated, where some hospitals get paid mostly by commercial insurance. They have mostly middle-class patients. They do really well. They operate at they're nonprofit, but they operate in the black. And other hospitals, the ones that serve poor communities, rural or urban, that provide certain kinds of necessary services that aren't profitable, like psychiatric care and obstetrics, really struggle. And they're going to struggle a lot more under this bill, especially if so many people become uninsured, right? Because it's really important to remember when someone becomes uninsured and they have, let's say, asthma or type 2 diabetes, what happens is they're no longer getting the primary care they need. They're no longer getting the medications they need. They wind up in health emergencies and they show up in the ER. And they have a right, thank God, to be treated in the ER, whether they have insurance or not. And so when uninsurance increases, that really, really impacts those safety net hospitals because they have more emergency visits and fewer people who can pay for those emergency visits. And their charity care, their uncompensated care goes up. This is a really scary situation for New York because we have a bunch of hospitals that already are receiving a bunch of state support because they can't operate on reimbursements alone. About a third of hospitals in the state are in that situation. And that number is likely to increase, and many of those hospitals could potentially go under unless we increase state support to them with such a large increase in uninsured. And that we've published research showing labor market impacts of that being really severe, 200,000 jobs across the labor market, including a lot of hospital jobs and jobs that are sort of ultimately funded by that. And then the potential for really a large number of hospital closures. So next slide. So just summing this all up, we're seeing like the potential for a really large state budget hole that is really front loaded. Like will happen in the next fiscal year, and it actually will begin in this state fiscal year for which we just enacted a budget. We're seeing an even larger health system impact where sort of the net potential decreases to all of the different providers that that provide care for people who will no longer have insurance or who will have different kinds of insurance are, that is almost $13 billion. And then again, a really, really large coverage impact, especially driven by changes to the essential plan and changes to work requirements. So next slide. The, I'll just race through this and say, there are state budget impacts, like when the state has to pay for the Medicaid for people kicked off the essential plan, or it has to implement work requirements. And then there are other things like the loss of insurance when people are subject to work requirements, where that's not a state budget impact directly. It's actually directly a state budget savings because the state no longer pays its share of Medicaid for those folks. But again, it's a huge burden on hospitals and other providers that treat them and on their communities. And ultimately, those two things converge because we all depend on the same healthcare system. If the federal government is no longer supporting the hospitals we need in our communities, then the state is going to have to take over that impact. And that will affect all of us one way or another, whether we step up and make the right choices to tax some of the rich people who are getting a tax cut and sort of provide funding, or whether we just allow hospitals to close, find out that our communities no longer have the access to healthcare they need. And so next slide. All right, I covered this. Next slide. I want to call out a couple of state level decision points. We'll be having a longer discussion of how the state might respond fiscally next week at this time. So stay tuned for that. But just to sort of frame the choice a little bit for people, I want to call out a couple of things. If this bill just sort of takes effect and we say, well, if the federal government is going to provide Medicaid for people, then too bad, they become uninsured, then, we're putting ourselves in a really stupid position, right? Because as I said, some of those people are perfectly healthy. It costs almost nothing to provide Medicaid to a healthy person, right? Healthcare costs are driven by, guess what, sick people. Some of those people are sick. They might, have a chronic illness like diabetes. They might get hit by a car one day. And when people have an illness like that, they're going to end up in the ER, and one way or another, we collectively are going to wind up paying for it. The difference is if they're uninsured, they can't get the primary care, they can't avoid the ER visit, so they wind up costing the health system more. And so we should think really hard about whether it makes fiscal sense for New York to just throw up its hands and allow people to become uninsured if there's a federal funding cut. Because that might sort of, when you type it into a spreadsheet, it might appear to save money, but in the long term, the health system impact of that is very expensive and potentially more expensive than just covering people. A second question relatedly is, how do we support safety net hospitals? We have this very irrational funding system that means that systematically and necessarily rural hospitals and hospitals in poor urban communities can never, ever operate in the black without state support, right? Because they get paid less for every single service they provide. And they also are subject to this obligation to provide charity care for people who can't pay at all. And that's a public good. That's what they should be doing. But it means they need state support. And with more uninsured people in this hit to the healthcare system, they're going to need more state support. So we shouldn't ever be in the position of accepting the logic of like, well, if that hospital can't make money, maybe it just means we don't need a hospital there. We do need these hospitals. It's just that without sort of intentional state policy, the game is rigged against them. And so we need to think about how we can support those hospitals. Next slide. Yeah, that's it. So I'll kick it to my colleagues for discussion of SNAP.
Thanks, Michael. So I will take the discussion on changes to SNAP, which are what we call food stamps, the Supplementary Nutrition Assistance Program. So Andrew mentioned a while ago that one of the major spending cuts that the legislation makes is to SNAP. It's much smaller in magnitude than the cuts to Medicaid and the Affordable Care Act sort of provisions, but it's still significant to the state budget. So there's, I would say, three big changes to SNAP that affect New Yorkers. First and the largest fiscal change is that there's something called benefits cost sharing. So the federal legislation pushes some of the cost of the literal SNAP benefits, like the EBT cards that people use to buy food. It pushes some of that cost onto state budgets. It can push up to 15% of the SNAP benefits onto state budgets. So that's the maximum is 15%. And it bases that how much the state has to pay on what's called the payment error rate. So, and that sort of varies from year to year. So it's a bit complicated, but basically this has a maximum fiscal impact of $1.1 billion in its first couple of years. Sorry, but that's 1.1 billion per year for the first sort of couple of years in New York. And that will begin in October of 2027 and will possibly increase in its amount in October of 2028. So that's a little bit far out, but that's directly the SNAP benefits, the food stamps that people are using to buy food. So this is like costs that if New York doesn't cover it, people will just simply lose access to food. Another cost increase for the state of New York is that there's an administrative cost sharing. So it has been the case until now that New York pays for 50% of the administrative costs of administering SNAP in New York. That's going to increase to 75%, and that's going to have a fiscal impact of about $266 million per year. That starts again in October of 2026, so a bit sooner. And $266 million is a little less, but it's still a significant amount of money for the state to have to cover. And finally, this is not a direct fiscal cost to the state, but similar to Medicaid, the SNAP. Could you
Great.
please make sure you're muted? So finally, there are new eligibility restrictions imposed on people, and these look like work requirements, and so they affect mostly parents of school-age children who are over the age of 14 and adults ages 55 to 64 who will now face sort of stricter work requirements. There's also new eligibility requirements for veterans, refugees, and asylum seekers. And so as with Medicaid, increasing sort of bureaucracy, administrative burden in the form of these eligibility restrictions and work requirements not only restricts like who is directly eligible for the program, but also will have an impact on people, especially the most vulnerable, people who are disabled and don't have the means or access to making sure they fill out paperwork correctly. So these new eligibility restrictions will directly impact the people who are listed in this table and will also have an impact on reducing benefits for people who remain eligible under the law, but face newly heightened sort of administrative burdens, and it makes them harder to access the benefit. So this is something to be aware of. It doesn't have a direct fiscal cost in New York, but it will affect who receives benefits, and this begins immediately. I believe that concludes our discussion of the spending cuts and the fiscal costs to New York, and we'll have time for questions. I want to just take one slide to sort of tee up stuff that we're going to talk about in more depth next Thursday at noon. FPI has the position that the state legislature should call for an emergency session, this fiscal year. The last time this was done was during the 2008 financial crisis. And sorry, I specifically mean the last time this was done to address a budgetary crisis was in 2008. This is important because we need to, as Michael said, some of the fiscal impacts start this fiscal year, so the state will need to raise revenue to be able to meet its obligations and to be able to pay for benefits that people are entitled to. It's worth noting that in this year's enacted budget, the legislature gave the governor extraordinary powers to cut spending, but this is sort of specifically in the case of a recession, and it's about $2 billion. If that were used or exercised, that the only way to that would require a spending cut. So that's why we believe that the state legislature should immediately call for an emergency session, because if there's any hope of avoiding a spending cut, there needs to be an emergency session to raise revenue. It doesn't say it on the slide, but there's also ample reserves currently to patch spending over the next year or so, although that's not a long-term solution. Again, we'll talk about this more next week, but there are 3 main revenue raisers that FPI is putting forward. One is personal income tax rate increases, one is changes to the corporate tax, and one that we haven't talked about as much over the last few years is that, you know, sales tax in New York only covers goods, like sales of goods, and it doesn't cover services. But if it were expanded to cover services, the state could raise a significant amount of revenue that way. All of this will be discussed in more depth at our briefing next Thursday at noon, and I will send an email about that in the next few hours, or just keep your eye out. So with that, we are going to move to questions and answers. Thanks so much. And
Emily, I'm seeing a couple of questions in the chat that I'd like to quickly address.
Oh, great.
Is that okay?
Yes, absolutely.
Okay.
Go for it.
Excuse me for totally murdering your name, but Fichaya Pino asks about sort of on work requirements, if someone fills out a form wrong or something, will they lose Medicaid and have to wait 6 months to reapply? The answer is that we really don't know how these work requirements are going to be implemented, and we expect that there will be a little bit of a back and forth between the federal government and the state, because New York State policymakers do not want to take away people's Medicaid, right? But they're under a federal obligation to, and I would, you know, the federal government gets to approve whatever plans they make to do that. And so we expect a back and forth and a conflict there around the question of like how harsh to make these requirements. Regardless, though, we expect, you know, the point of this measure is to kick people off Medicaid, and it's the biggest pot of savings in the bill, so we expect a push there. Steve Auerbach asked a couple of really good questions about a program in New York City called NYC Care that is run out of health and hospitals and provides health care for undocumented immigrants who currently aren't eligible for Medicaid, either at the state or federal level. And what's the impact on that? I think that's a great example of, like, with so many more uninsured people due to immigration status, we can and should expand that program, but it's run out of health and hospitals, New York City's public hospital system, which will be really, really financially stretched. So that's going to be a challenge for the city. Steve also asks about, the state has done this really wonderful new program where children ages 0 to 6 get continuous coverage under Medicaid. Will that be impacted? I think the answer there is not directly, because most of the Medicaid eligibility stuff is focused on adults, but that program is approved under New York State's 1115 waiver, and that waiver will be up for renewal in 2027. We expect a really big fight with the federal government to get any renewal on that, and so that could be an impact there. So just wanted to take a couple off the top.
Awesome. I see that Susan Welber has their hand up. Susan, do you
Yeah,
wanna-
hi. I just wanted to, I put this in the chat, but I just want to make sure everyone hears this because it's so shocking that I think a lot of us it's taking a little while for it to sink in. So the bill that was passed, the final version, excludes whole categories of non-citizens who were eligible for SNAP from SNAP participation effective immediately, but as a practical matter, I don't think it's taking effect immediately. And it's really kind of shocking. They are excluding wholesale. This is not through work requirements. Asylees, refugees, um, domestic violence survivors who have filed VAWA self-petitions and their children, T visa holders, some of the most vulnerable and likely to be exploited folks. So these are really big changes to SNAP eligibility. And while that might not have a direct impact on the state budget, it does sort of point in the direction of solutions like the one that Hunger Free America is pursuing, of a state fund that serves people who are not eligible for SNAP. It just made that program all the more important and somewhat more expensive. So I just wanted to make sure that everyone was aware of that.
Yeah, thank you so much for that. I also see a hand up from Joe Mayhew.
Yeah, hi, thank you. So my question is in regards to, they use the word exceptions on the 80-hour rule when I read the documentation. And in particular, and I just want to preface this by saying, I also asked this question to Mike Lawler, Representative Mike Lawler, in his town hall regarding workers who may be seasonal workers and a particular job they have maybe doesn't last as long as they thought because due to possibly weather or a possible layoff, maybe in a construction job that gets done faster than they expect, or just simple illness that puts them to a position where they can't make the 80 hours in a single month. My question is there any um, concrete answers to whether how someone would go about getting exceptions so they don't lose medical for the entire year because they missed 1 month due to something that was no fault of their own?
There are not good answers to that question, Joe. It's a really good one. The processes for checking the work requirements and for seeking exceptions are TBD. I would just say people who are in that kind of situation, even if there's theoretically a system right in place that is going to help them maintain coverage, the odds of someone in that situation actually sort of making it through from getting a rejection letter to applying for an appeal to whatever else are really low. And that's just the way government eligibility checks work. Anyone who's ever had a little bit of a weird situation, like, when I used to freelance, it's hard to navigate those systems. Again, the point of the work requirements, we know they don't incentivize work. We know they don't, do anything useful. The point of the work requirements is to kick people off Medicaid.
And I absolutely agree with that. The answer I got from Representative Lawler was completely inadequate. And when I asked him, have you ever tried to apply for these benefits to see how difficult it is to go through this? Can you imagine looking for an exception? So I appreciate the answer and I agree with you 100%.
All right, well, thanks so much for that question, Joe. How about Celeste? I see your hand up.
Hi, I'm just wondering if this might be an opportune time to push even harder for the New York Health Act. It's been kicking around in the legislature for more than 30 years, and sometimes it gets some traction. This is a single payer health plan for New York State, and given all these draconian cuts from the federal government, just from a from a fiscal point of view, does it make any sense at all for New York to really consider just moving to its own single payer plan rather than dealing with all this craziness from the federal government? Do you have an opinion on that, is what I'm asking?
Michael. Oh, Michael, you might be muted. Ah, it's Michael. I think that I'll just jump in since I don't know where Michael went, but the Fiscal Policy Institute typically has focused on reforms to healthcare that feel more sort of immediately available. But I believe that our stance is that, yes, this is a good moment for New York to consider sort of major reforms to healthcare, and the New York Health Act is among those.
Yeah, thank you.
Heidi?
Yeah, just on that, the New York Health Act relies on many of these federal funding streams that are being cut to implement itself. So, but the other thing that I've been trying to find the clearest way to explain this for a number of months now is that people on Medicaid, people with ABD, which is age of blind and disabled Medicaid, are not the only people with disabilities. And in fact, American Community Survey data, which asks questions, it's, part of the census, and it asks questions about whether or not people have difficulty seeing, hearing, ambulatory, cognitive, self-care, independent living. And it asks these questions of people who also identify themselves. It asks a lot of questions, but it can narrow it down and state by state and even into the county. For people who use Medicaid who are between the ages of 18 to 65, whether or not they have these kinds of difficulties. And this means that they have some disability. And these are the exact people that will be removed from the Medicaid rolls due to work requirements, because we don't have employers that just love to accommodate these kinds of disabilities. And so they are not working 80 hours a month. And we also they have difficulty proving disability because we have a very high bar for proving disability. So they haven't been able to prove it, but they have these difficulties. Right. They identify as having these difficulties, and these are the people who try to lose Medicaid.
Right, absolutely, and that applies to SNAP as well. That the
That's true. I was a legal services attorney when the SNAP requirements came in, and I had exactly one of those people who worked to capacity as a school crossing guard, but it was not 80 hours a month, and he lost his food stamps. Now he would lose his Medicaid too and never be able to prove disability, because you need to have medical evidence to prove disability.
Yeah. I'm going to move to Greg David.
Yes, you didn't mention the Alaska exemption, and when I looked at New York's error rate, it seemed to be pretty close to Alaska. So is there a chance that the Alaska exemption will delay the SNAP cuts in New York?
Good question. Andrew, do you want to take that?
Sure. So our $1.1 billion estimate is based on our error rate remaining in that sort of top band, which is where it currently is. It's possible. So the Alaska provision lets you select the lowest of your rates just for federal fiscal year 2028. So that's gonna, take effect October 2027. So it's really state fiscal year 27 and 28. So it might mean that New York State SNAP share is lower just in that year, after which point I believe we'll just be on the 3-year average error rate like everybody else. And so if our error rate remains in that highest band, then it will get kicked up to that 1.1 billion. So it's possible we'll get sort of 1 year partial reprieve. I'll note in general that the SNAP error rates we reviewed a couple of past years, not just for New York, but for other states, they fluctuate quite a lot. So there is a lot of uncertainty baked into that. I mean, if it remains high for both of the next two federal fiscal years, we might not get any reprieve even in federal fiscal year 28.
Thank you.
Steve Auerbach.
Hi, I just on the could be doable and boy do we wish. I'd put in that we could have massive Medicaid savings even without increasing taxes on the rich. If we went to instead of the Cuomo fragmented for-profit version of Medicaid managed care, if we went to the Connecticut model, passed in Connecticut, it's real. There's a model out there of a single statewide not-for-profit Medicaid managed care model. Saves lots of money, which could then be, however much we are getting, could then be actually used to cover people. And then secondly, there's a ongoing thing in the chat, and I would just refer folks to a letter to the editor and essay written by former Assemblyman Dick Gottfried on the argument of New York Health Act now more than ever, as the counter argument to it's not feasible, and what, given what the feds are doing, state-based single payer is a now more than ever issue.
Yeah, just speaking to some of that. Sorry, I got cut off earlier. My Wi-Fi broke. I think that this is the time for us to be creative and ambitious in our healthcare policy, because it is not, one of the great things about US healthcare is it's one of the few areas where we spend more than enough, right? Like there's no lack of spending on healthcare in the US. The problem is that it's poorly distributed. I think expanding state-funded programs to provide insurance and all the way up to the New York Health Act is an idea to explore. I definitely think that taking our Medicaid system back from managed care companies, for-profit insurance companies that take some money off the top is a way we could save money without hurting patients, and then reinvest that in supporting coverage. So co-signing that.
Emily, you're muted. I don't.
Oh
but
yeah, well, I
can-
just called on you.
Okay.
Sorry.
No worries. Sorry to take us back, but Andrew, just for clarification, for that provision, was it just for Alaska? I thought there was a list of states that for the SNAP provision, and in that like SNAP provision, I thought it said like if for fiscal year 2025 that the error rate is multiplied by like 1.5 is equal to or above 20%. So when you're referring to 2027 error rates, is that what we're looking at, or is it fiscal year 2025?
Yeah. Good question. So I know that the Alaska provision does affect New York. I think we're in the top 10 states by error rate. So we are going to fall under that. And then for the timing question, it is, so the provision means that the sharing rate kicks in federal fiscal year 28, and states can select the lowest of the error rates in federal fiscal years 25 and 26, after which point it's an average of the three most recent years. So our 2025 error rate is going to matter as the basis for that first year of SNAP benefits sharing.
Thank you for that clarification.
Mm-hmm. Sure.
I don't see any other hands up, but I'm sure there's questions in the chat that we haven't gotten to. If we haven't gotten to your question, please feel free to raise your hand and I'll. Debbie Chatterjee, I see you raising your hand.
Hi, just quickly want to point out that we use error rates, but these are not not real, like they're not really people deliberately, who are ineligible or who shouldn't be getting the assistance. That it is mostly in 90% of cases, these error rates are typos. As the caseworkers are working, someone is getting less than their maximum eligible benefit, or someone is getting someone is getting slightly more than what they should actually require. So by using this error rate, it is a very noisy and unreliable measure of really anything. You are processing millions of rows of assistance. It's totally possible that completely automatically, just because of systems, some of these numbers can move from here and there. And so using this error rate, it is just like something to latch on to for other political objectives. It doesn't represent fraud.
Yeah, that's absolutely right. And I do want to note, I think I just mentioned that it jumps around a lot. And I really want to put a point on that, because Debbie's right that it's sort of a statistical construct where the state has to send a subsample of our SNAP filings to the USDA, which then conducts their own analysis. So it's a sort of statistical analysis of what they think any error in any direction is, as Debbie mentions, and it's quite noisy. It's not really smoothed out the way that sort of official statistics that are generally used for sort of real triggers. It's a pretty noisy sort of statistical selection. So yeah, Debbie's absolutely right about sort of some of the problems with using this for such an important provision.
Thanks, Debbie. Daniele Gerard.
Yeah, hi, thank you so much. Thanks for an excellent presentation, as always. Looking forward to seeing a lot more of them. I just wondered if there's any breakdown about how many children on Medicaid are going to be affected by the cuts in New York State.
Michael, that's sort of a question for you, I think.
Yeah, and it's a tough question to answer. Many of the harsher eligibility restrictions on Medicaid do not apply to children. But the huge budget crunch and hospital closures will certainly impact many children. And of course, anything you do to parents impacts children. I want to call out the restrictions on the child tax credit, requiring parents to essentially prove citizenship in order to access that tax credit. Will put a really deep burden on a bunch of families, including immigrant families, but also anytime you increase paperwork, you impact low-income people disproportionately in all the ways we know.
Eve Creef.
Just a follow-up on what you just answered, in addition to what I was going to answer. Is it true then that children who receive Child Health Plus, if they have one parent without a Social Security number, they wouldn't be eligible for Child Health Plus, or that's not a thing? But my other question was about universal meals inside school, if that's going to be impacted at all.
What I said about the child tax credit was just about child tax credit. I believe Child Health Plus, budget crunch aside, the eligibility is going to be largely the same, with the exception of some immigrant populations. But I would need to follow up on the details of that. And I'll kick to, I guess, Andrew for school meal.
Well, oh, Andrew, you're muted. Andrew, correct me if I'm wrong. The school meals funding that was in the most recent state budget doesn't get directly impacted by the federal budget. But I guess one of the points we're trying to get across is that the state, if revenue is not raised to fill some of these gaps, lots of programs will be at risk. And so I don't anticipate that specific program will be cut, but that's the type of thing that, that's why we're sort of pushing for there to be a special session, because otherwise the state will have to make, challenging choices about where to cut programs.
That's right. The universal school meals was recently passed with state money, but it's complemented by a pretty substantial federal support along the existing program. That program was not affected by this bill, so that's all intact. Doesn't necessarily mean we're out of the woods when the federal we need a federal budget in October, because we know that some of those programs were have been targeted by Republican lawmakers. But for now, that funding is not affected.
Do you all know, and I know we're all still digesting the bill, so apologies for all these questions. But do you all know if the provision in SNAP now changing dependent to being under 14 years of age is going to impact healthy school meals or any other initiatives, food initiatives, and access to even Medicaid and other benefits?
Andrew, do you, I think that, well, Andrew, do you have an answer?
No, I don't. That's a good question that we can look into. Yeah, if it reduces sort of federal reimbursable eligibility. Because as I said, we get the federal reimbursable eligibility, which is not affected, and then the state complements it to get universal school meals to all schools. But yeah, if that affects federal reimbursement by changing SNAP eligibility, that seems like a potential, but we'll have to investigate that. It's a good question.
I see Elena asked and Emily answered a question in the chat that's just like, when I say there are $10 billion in fiscal impacts and then a $13 billion healthcare system impact, are those sort of like separate or overlapping? Those are separate. So you can add those numbers and get to 23 billion in sort of total costs and increased increased both like cuts and increased costs to the state. Just clarifying. So it's a lot of money, and that's an annual figure. Putting that in perspective, the New York State budget as a whole, inclusive of federal funding, this year is about $250 billion, right? So we're not talking about half the budget here, but just it is a lot of money.
I'm just going to answer Chuck Bell's question about low-income heating and energy assistance program, LIHEAP. That, I think DOGE cut the LIHEAP sort of federal workforce, but there haven't been cuts to LIHEAP benefits yet. There is some change in the SNAP provision that I'll have to get back to you on the specifics. There's some change in reimbursement via SNAP for energy costs. And I can maybe talk to you offline about that, but the LIHEAP funding hasn't been, the budget just hasn't touched it yet. And just while I'm talking about it, like the budget also hasn't done anything on Section 8 housing. So that's not to say that there won't be cuts in the future.
I've had a delivery that's maybe been sitting there for half an hour.
And could you please mute yourself? Sorry. Anyway, does that make sense? So
yeah.
Those could be forthcoming, but they haven't been.
Yeah, I read that the Congress was trying to cut back on more generous food assistance benefits for people who get LIHEAP. So like there's some, I guess it's like a program provision in the bill relating to that.
Yes, that there is a provision that is restricting SNAP benefits for LIHEAP recipients, but I forget the details of it right now, so I'll have to get back.
Okay, thank you so much.
I think if I don't see any more questions, we're going to wrap up. Please feel free to email us if you have future questions. We're going to post the slides and the video, and we appreciate the conversation and your presence. Thanks so much, everyone.
Where is this going to be posted?